Hello, welcome to Healthcare Triage Live. While we get everything going here, we're without Stan this week. He left us. So Mark and I are trying to pull this off ourselves and doing a great job. The first thing we want to announce is that we actually have some new merch. HGTmerch.com. There's a lanyard and there's a lunchbox, and they're both very reasonably priced, less than I thought they would. And they'll be ready in time for the holidays. So that's why they're out now. If you order them now, you will get them for the holidays. It's going to be great. It's a great way to support the show and get cool Healthcare Triage merch. HGTmerch.com. Thank you as always. If you can support us on patreon.com/healthcaretriage, we really appreciate it. Every little bit helps. Keeps the quality of the show up. We don't really need that much to operate, but you know, it still costs money to make YouTube stuff. You'd be shocked. Facebook.com/healthcaretriage. The Reddit site, it continues to grow. Everything is great. Let us begin. Question number 1. Caregivingly, what is the difference between cardiac rehab and exercise after a heart attack? Well, so the difference that I would actually argue is that rehab specifically has benchmarks for improvement and is usually for some period of time, and then that is it, and then you're done. And that is to get you back to sort of functioning in life, while exercise should be an ongoing, lifelong thing. They could be the same exercises. They are likely not, in the sense that exercise is going to be stuff. Can you all hear that truck? Because it's amazing. Exercise is usually sort of oriented both towards strength training and for cardiovascular health, while cardiac rehab likely has a very specific focus one way or the other. But in general, they could be used interchangeably. But again, exercise forever. John, our doc recommends vitamins for our infant. Try Visol. What's the research on infant vitamin needs, and are they regulated? A little bit more so than probably like regular vitamins are, because sometimes they're used like medication. So the vitamins that we usually do is infants get vitamin K after birth. That's to prevent bleeding disorders. Infants will often get vitamin D if we believe that they are at risk for vitamin D deficiency, either due to breastfeeding or the time of year and a lack of sunlight, or to race or other reasons. And sometimes if pediatricians think that infants aren't eating especially well, they will assign them just a multivitamin. Now that's where the evidence gets sketchy, because if infants are breastfeeding or eating formula, they're getting the vitamins that they need, other than, like I said, supplementation with vitamin D, sometimes iron too, I should say iron, and K at birth. But Trivisol is just, I think, a pretty standard vitamin. It's probably pretty reasonably well regulated. If you have questions, you should ask your doctor. Why do they think your baby needs vitamins? Do they think your baby is vitamin deficient? Do they think that feeding is going wrong in some way? Because babies that are eating normally in general do not need a general multivitamin. They don't. Blue Anthill asks, how should I handle a clinic that has not given me my test results in a timely manner? It's happened like 5 times. All right, so a couple things we got to parse here. One, what's timely manner? What you think is timely manner and what the clinic thinks are timely manner, maybe 2 separate things. You should have a discussion. 2, some clinics these days are offering ways to look up your own labs online, and therefore they don't feel like they need to tell you as much. My hospital system has a portal where I can go look up my labs, even if I wasn't a doctor and able to access the EMR. And so I do that. And if you go look up your own labs, they might not feel like they need to call you as quickly. The third could be that the clinic, it's not really the clinic's fault. It could be that they have to send the labs out somewhere and they relies on some like fax technology or something, and they get behind. That could be it. But let us assume that your sort of like portrayal of this is correct, and they have the labs, they're supposed to call you, and they're not. You should tell them. You should talk to the doctor. You should talk to the clinic manager, whoever's responsibility it is, because this is not appropriate. And if it continues to happen and they ignore your needs, I'd argue that this is not a clinic that seems to care about your opinion or what you need. And so then I would consider changing clinics if it really bothers you that much. On the other hand, like, what are the labs? Are they really an emergency, or are they the kind of thing that you really can get whenever? Were they wrong, and their failure to tell you, or bad, and their failure to tell you led to health consequences, or were they completely normal results on labs that go again and again and again? So, decide for yourself how important it is. Aaron Schaefer, NPR and other news outlets have reported extensively on the upcoming rise in rates in the AC exchanges. Why and what steps can be taken to reduce the cost? So I have refrained as much as possible from covering these like scare du jours because it is very hard at the moment to discuss healthcare policy and anything that is not framed election-wise. I will give you my dispassionate answer on the 25% increase in rates on the ACA. One, that is an average rate. It's going up in some and down in the others. Two, when the ACA first came out, the CBO did projections in 2009 on where they thought insurance premiums would be on the exchanges for years going out. The private health insurance came in under what the CBO predicted. Now, against them, a lot of people who supported the ACA got super excited when this happened, and they're like, yay, health insurance is costing way less than we predicted. But it turns out that when the insurance companies made those especially low rates, they underbid. And now they need to make a course correction. So the rates now that they are raising everything to are amazingly enough very, very, very close to what the CBO predicted they'd be in 2017 back in 2009. So it turns out that this isn't an increase so much as it is a course correction for underbidding it originally. Was that underbidding bad? Yes. Should we have been more wary about it at the time? Yes. Should the supporters of the law not have perhaps gloated so much when they saw that because this might have happened on the back end? Yes. But regardless, it's not doomed for the ACA as much as it is, look, this is almost exactly where everybody thought it was going to be in 2017. Three, what we're talking about here are rates that affect lots of people get subsidies in the exchanges. So 17% of like the 9.1 million people who get insurance in the exchanges don't get the subsidies. These rates mostly are affecting them most of all. Is that a tragedy? Yes. Do I wish it wasn't occurring? Yes. But we're also talking about 17% or 19% or whatever it is of 9.1 million people. That's like 2 million, 3 million people. That's who this affects. Is it a tragedy? Yeah. Is it like earth-shattering that less than 1% of the population is going to be affected by this? No. And when we start going crazy about something that affects 1% of the population and start talking about major changes to the entire healthcare system because of that, it's getting a little out of whack, and that's when you know it's about election news. Three, people who've entered the ACA have tended to be sicker than people predicted and older, according to some reports. That's because of pent-up demand. That's because they couldn't get insurance before. They've cost more money. Yes, it's a problem. That is existing. All of this together should be taken to mean that like this is, that's also, one more thing. That's also your rate if you don't shop around and change doctors. If you're willing to, change plans. If you are willing to shop around and change plans, most people won't see any increase at all, or lots of people won't. That 25% is only if you adamantly refuse to change your plan and stick with it. That's what people say. Now, I will hear from people who will say, well, that's not fair. I shouldn't have to change my doctor. That's a problem with the ACA. To which I would respond, okay, but I never want to hear from those people again about how free market is what's necessary in healthcare. Because the only way a free market works is if people become price sensitive and are willing to change based upon increases in price. If you agree up front, no one should have to change, no one should have to move, people should get whatever doctors and plans they want. You may not talk about free market again or capitalism again in healthcare, because that means we can't have a health market. Because if people just get to stay at the same doctor and the same plan, regardless of where the price goes, no market, no free market. This is how competition works. Now, I'm willing to let go of the market, but a lot of people who argue against it aren't. All of this should mean to say like, yeah, is this something that needs to be fixed? Absolutely. We could fix this by improving by many of the things that I talked about in previous healthcare triage news and healthcare triages. We can make the individual mandate stronger to force more healthy people into the market. We can increase competition. We can increase the subsidies. We can provide more sort of lanes and programs to help insurance companies predict what it's going to be and protect them when they get it wrong. All of those things will cost money or be unpopular, and I'm not seeing Congress willing to do any of them. But there are problems that need to be fixed. I encourage you to go read my post. Another person writes, on Patreon, how to decipher actual advice from pseudoscience that some MDs sell in books. I'm like less than a month away of turning in my book on nutrition, so it's a good time to talk about it. I usually say, you know, one, you have to learn to trust people. They have to have a track record. You shouldn't buy something from someone just because they're an MD. I hope you are a fan of the show. I hope you are willing to listen to what I have to say, because I have built a track record through videos, through writing, through columns of being this passionate and fair about research, about explaining to you why things are true, not just that they are. I'd also say you can, when people are selling you quick fixes or easy answers, that's usually pseudoscience. When it's something where they're telling you everyone else has got it wrong and the establishment's lying to you, that's usually pseudoscience, because, you know, doctors want the best for you, as does the medical establishment. They're not trying to hide the truth from you. You'd have to believe that people like me are trying to hide the truth from you, and that the doctors you know and are friends with are trying to hide the truth from you and from their own families and friends, and that's really not happening. When people are, you know, selling you stuff that they're going to make money off of, like their own diets or their own shakes or their own cleanses or all those other things, I would tend to not believe it. And when they're really harping on, you know, sort of like, you know, when they just refuse to sort of get into the research and they keep it secret. I saw a great article today talking about like the new like nutritional science, about like, you know, getting individual stuff on nutritional science. And again, like other things that have happened in the media, they refuse to discuss the science, they refuse to do controlled trials, they refuse to test this. I'd be really skeptical at that point. Patreon question again, what's the truth behind cleanses and protein shakes and all that other fad crap? The truth is they don't work. They don't work. It's a chapter in my book. You don't need to detox, you know, unless you're a drug addict or an alcoholic. Then you might need to go through detox. But other than that, your body's incredibly good. The liver, the kidneys, the skin, the organs that you have to help, you know, break down bad stuff and get it out of your body, they work really well. You do not need to detox. Protein shakes are built up around the idea that you can't eat adequate amount of protein and we need to process it and get it in there. That's not the truth. You don't need, it's fad. I think you answered your own question. It's fad crap. There you go. Patreon question, sleep quality as it relates to aging. When is more sleep worse? So, almost never. It is bad if it's a marker of depression, which it sometimes is. It is bad if it's a marker for your being sick, which it sometimes is. But if you're a healthy person, trying to get more sleep is rarely bad. Now you will see studies once in a while that argue like sleeping more is associated with a higher risk of death. Those studies, those are almost all observational, and what they're showing that is sometimes that sleeping more is associated with a higher risk of death. But they fail to account for reverse causality, that older people, sicker people, people near death tend to sleep more. And if we stop them from sleeping, we would not prevent their death from old age, from cancer, from illness. It's not the causal pathway. It's that sicker people sometimes sleep more, not that sleeping more makes you sicker. So don't take those associations and make them into causations. Patreon question, can I continually eat 5 grams of creatine monohydrate each day without cycles? And why do my joints feel much better when I eat creatine and start to hurt during or after the physical exercises when I stop eating it? So, I'd argue it's the placebo and the nocebo effect most likely. Why? Because that's what studies show. That these kinds of things don't, in controlled trials, make a difference. If you really wanted to test it, you could even do an N of 1 trial yourself. Find something else which looks the same, or have someone, perhaps a spouse or something, you know, give it to you or not give it to you by mixing it into a bed. And if you can't tell the difference, then you try to pick the days or the weeks when you think you're getting it. And I'm willing to bet if you truly do a randomized, blinded trial where neither you nor the person measuring it can tell you like when you're getting what when, that you wouldn't see the differences, because they don't show up in trials. If you do this and I'm wrong, you let me know. But of course, if you do this and prove me wrong, you could publish in the medical literature, and these industries would be really excited about it, because that really hasn't happened yet. Patreon question, thoughts on basic medical education in primary and secondary schools? My high school taught me CPR, first aid, and AED in health class, but I've learned that they no longer do so. Well, I mean, okay, first of all, basic, you know, getting trained in basic life support is not a terrible thing. That actually works. Like, you know, knowing how to activate the first aid system, knowing how to use an automated AED, knowing how to do CPR. Those are things that actually work, and so I am fine with it. Now, Whether or not it has to happen in school or somewhere else is completely different. And if you're talking about it in school in terms of like education and being smarter, no. If people might learn it because it helps with health, sure. But that has to, be recertified and keep doing things. I'm going to bet that it stopped getting done in school because of budget or time constraints, and I'm sensitive to those, and so they have to weigh opportunity costs of doing one thing or another. You should check with your school system to see why they made that decision. Patreon, do you need to change your mattress every 8 years to avoid back injury, or is that a marketing ploy? All right, well, those are two separate things. Do you need to change it to avoid back injury? No. Is it a marketing ploy? Yes. But is there perhaps some truth that some mattresses might be less comfortable after a certain amount of time? Oh, God, yeah. I've had mattresses that, started to sink after a while, but the last mattress my wife and I bought was like 13 and a half years ago when we moved to Indianapolis, and it's still great, so we don't change it. But if it stopped being comfortable, we would, but I'm not worried about back injury. Patreon, is the breath self-exam working, or is it causing more harm because of needless biopsy surgeries and anxiety? That is a controversial question. The most recent USPSTF guidelines, I believe, actually have said we should not be doing, breast self-exams, that they are doing what you say, not decreasing mortality. They are picking up more noise or things that we shouldn't be worried about and causing mental stress, anguish, more biopsies, more so all of these things that you're bringing up, more mammograms, more radiation. And so the last, I think, set of recommendations advised us not to keep pushing those. Other organizations have fought back very strongly that that's a mistake, and they cite anecdotal stories and this and that, but the evidence overall says that it's not quite clear that they are doing us more good than harm. And so I believe the last set of guidelines said not. You should talk about this with your doctor. Another these are all like Patreon questions. Lots of Patreon questions coming in. When you have a cold, is it better to constantly spit or blow out the phlegm from your nose and throat? Is it better to get the gunk out of your body, or might it be better to keep it inside because maybe you get more dehydrated plus spread more germs by purging it? All right, so your body, when it creates the mucus and then puts it in your nose to run out, that is your body trying to get it out. A cough is your body's attempt to get it out of your lungs. So your body's trying. You shouldn't fight your body and try to keep it in there. Now, hawking a loogie and spitting it out into the air is not good for just infection control in general. It also won't make you very popular. And if you're trying to overdo what your body's doing, who knows? That might be questionable. But your body doesn't want to keep it in your nose and sinuses. It's trying to get it out. Your body doesn't want to keep it in your lungs. It's trying to get it out. That is all garbage. You will not dehydrate yourself from blowing your nose or from spitting. That stuff is already bad, and your body wants it out. There's not that much liquid in there, and as long as you're drinking and doing everything else normally, you should be fine. I would not be trying to retain my mucus or my boogers because I'm worried about dehydration. I have never heard anyone advocate for that. Why is the recent nutrition fad to tell us to eat more protein? It feels like the low-carb diet again, even though it doesn't seem to take in that much protein. This person's vegan sister and her 5 young kids, most of which have never eaten meat. The whole idea Americans don't have enough protein is ludicrous and a throwback to his days in the Air Force or her days in the Air Force, where there were a bunch of meatheads taking protein shakes and pre-workout powders, so not exactly the picture of health. I'm going to take exception with the way you're framing this. I will agree with you that trying to do protein shakes and trying to eat tons of protein other than what you would in a normal diet is somewhat crazy and a fad. We're doing processed stuff to eat. It's not necessary. But here's the thing. You got to get calories from somewhere. Those are going to come from fat, from carbs, or from protein. And for a long time we said, keep it, low fat. And because it was low fat and people worried about fat being in meat, everybody shifted to carbs. And they started eating low-fat stuff that was high in carbs, and that not only coincided with the obesity epidemic, but lots of diabetes and everything else. These days, there's a shift back and saying maybe all those carbs are not a good idea. Maybe fat is okay. Maybe meat is okay. That is not necessarily to say you have to eat a low-carb, high-protein diet. It's just a shift of where it is. I don't think... there are definitely people, the paleo people, there are people, the Atkins people, who will say you need very low carbs, you need to massively push protein. I don't think that that's necessary for everybody. But I would also say that shifting us back towards protein and away from carbs is not a terrible idea, given that many people are eating probably too many carbs, especially processed carbs. And so that doesn't mean you have to eat meat. But again, you got to get your nutrition from, you got calories from something. It's going to be fat, carbs, or protein. And if you eschew protein and you eschew fat, you're getting all carbs. If you eschew carbs and you eschew protein, you're getting all fat. You got to get something. So I think shifting it back towards protein is not the worst thing in the world. I think that that's not unreasonable. And I think you're going to see lots of diets, even those sort of the bland, middle-of-the-road diets that get recommended, have a balance between protein and carbs and fat, even if they are vegan. No one is saying meat, they are saying protein, and you shouldn't confuse the two or think that they have to be the same. We are the parents of a bedwetter, and it's been difficult to sort through the information to find a solution. Have there been any good studies about this problem? Not as many as you would think. We're actually trying to do one right now. That over at IU, I'm doing it with some colleagues. So anyway, if you get away, there have been some studies that show when it becomes a real problem, there are some medications that can help, but that's a minority of people. There are also some studies that show that this is a very common thing and it actually is very familial. It must be genetic in some way, so that it runs in families. Therefore, people sometimes freak out about it when they don't need to, because it is a very normal thing that almost every single person outgrows. Some people stand by the bedwetting alarms. They just prime people. Some people stand by these new gizmos. Some people stand by trying to limit fluid intake before kids go to bed. A lot of these things are just temporizing until kids outgrow it. I wish I had more detailed information for you. But I would want to know, if I was talking to you, how old is your child? Is there a family history of bedwetting? If the answer to that is less than 7 or 8 or 9 or less, and yes, that there is a history, I'd say it's unfortunately, it is just a normal part of growing up, and some kids have it worse than others. Is coffee really bad to drink when pregnant? Oh my God, it's in the book. Or is the caffeine and therefore decaf is fine? So, if I'm summarizing quickly, although I encourage you to go get my book when it's out next year. There are some studies that show at a very high level it can be increased with some levels of problems, but almost all of those are like over 2 cups a day. And most of those studies are not great, but it is clear that there doesn't seem to be any harm at all from 2 cups a day or less. And that the risk is not that great, especially once you get outside the first trimester, even at slightly higher levels. But there is some association, and we're not going to do randomized controlled trials to try to cause preterm labor or problems with kids. So, when you get up to a certain point, we just don't know. But I would say, yes, it looks like 2 cups a day or less, totally fine. Probably a little more than that, most likely fine. What age is autism usually diagnosed or noticed? Ironically, so this is the thing, usually between 1, 2 years and older, which also happens to be the time you get the MMR, which is why the MMR got associated. It's when parents look more, that's when they see it. Sometimes it is later, sometimes it is earlier. It is why we try to do universal screening these days, certainly by 18 months, because we want to try to pick it up. At least some people do universal screening. The USPSTF has said maybe there's not enough evidence to do that. People will disagree. We've made a video on that. I encourage you to go watch it. But usually, if you're truly paying attention and doing stuff, maybe by 12 months, certainly by 18 months, you can start to pick up some of the things. And if you're concerned, you should talk to your doctor about it. Is there a widely recognized accepted way of washing hands? Water, temp, time, amount of scrubbing. Yes. So, again, so the water temp probably doesn't matter unless it makes you more likely to do it. Time, I think most people are, what is it, a minute or 30 seconds? I don't know what it is, but it's real scrubbing. Interestingly enough, it is the scrubbing that is so important. It's not necessarily the type of soap you use. You want to physically scrub the stuff off. That matters, and then rinse it. So it's wet. It's usually I can't remember if it's 30 seconds or a minute, whatever it is. Let's say a minute because that's what they're going to say. Most people don't do that though. That's what they say. And then, of vigorous scrubbing with soap, then rinse it off. But you can just go look it up. I'm sure the CDC has it, an easy thing to look up on the website with standard stuff that you should do. Let's see if we can get to 1 or 2 more. Why does beta carotene increase the risk of lung cancer in smokers? Yeah, I'm not 100% sure that is proven, You know, so many problems with observational studies with smokers because smoking clearly causes lung cancer, and things run along with smoking, like whether or not you drink, whether or not you eat healthy, whether or not you exercise. So all these things get lumped up in there. I don't know that it's definitive beta carotene, lung smoking, it's something. I'd have to look it up. Last question. What can be done to improve accessibility to clinics and health professionals so that women can make informed decisions and have autonomy over their bodies? Why can clinics get away with misleading women and giving out biased and worse incorrect information? Because that's politics, and that's the argument we're having nationwide, and you want to fix that? Go vote. We can try, you know, whether or not you want to improve access to birth control and improve access to abortion, improve access to things like that, is a choice that gets made to some extent at the voting booth. Make it. Choose best what you think is best for you. Choose what you think is best for women. Choose what you think is best for society. We at Healthcare Triage aren't going to tell you how to vote, but we do certainly talk about what the differences in policies that what improved access to improved access to birth control does. We've done videos on that. What improved access to safe and effective abortion does. I'm sure we've discussed that on Healthcare Triage before. How do you improve the access for that in clinics and health professionals? Change policies. Go vote. And that's a great thing to end on, because the next time we see you, the election will mercifully be over. Oh, thank God. But you should go vote. Voting is important. It's less than a week away. Go do it. Thank you for watching. Check out the new merch, hctmerch.com, patreon.com/healthcaretriage. Continue supporting us. Tune in next week for Healthcare Triage. Watch Friday's news. Watch Monday's episodes. If you still have questions about who you're going to vote for, still go back and watch our recent episodes, both on healthcare policy on Medicaid and specifically on talking about the two healthcare reform proposals being offered by the two different candidates in the major parties. Go watch those, make an informed decision, and go vote. See you next week.